Hi guys, my name is Michael Moore and this is my evidence-based practice PowerPoint presentation for my senior project. Yay! Alright, my PowerPoint presentation today is going to be on unit-based residency programs versus traditional overall general residency programs. So let's get started. So this is the abstract. You guys can read it for yourself. I'm just going to summarize. Basically what it says is that all new nurses, either new to the facility or new to nursing, go through some kind of residency program. And it's usually a very general based residency program, and there are advantages and disadvantages to that. One of the advantages is that you know coming into it as a new person that you're not alone, that there are other new people coming into it. Some of the disadvantages of that is that sometimes the subject material doesn't really apply to you and your floor and your setting. And so this is why I think a unit-based residency program would be better. So my overall goals for this program is to increase nurse confidence, which is going to cause the nurses to stay on the floor longer and reduce turnover, thereby creating a bigger pool of nurses to draw from. You're going to increase or decrease patient ratios, and you're going to increase morale and teamwork, and you're also going to just develop happier nurses, or more confident and content nurses on the floor, which is going to improve patient outcomes, because when you enjoy your job and enjoy coming to work and taking care of people, patients are going to greatly benefit from that. Alright, introduction, 3 slides in. My name is Michael Moore. I'm an RN, ADN. I graduated in the 2017 class, Columbus Technical College. I've got about 1 year and 4 months on the med-surg floor, ortho-trauma at Columbus Piedmont Regional. The goals of the residency program, I just briefly touched over that, is just to create an environment that nurses feel confident and comfortable, and working with the people that they're going to be working with to get them to that goal is going to increase teamwork and morale. So one of my goals is nurse retention in relationship to improve patient outcomes. And I, again, kind of touched on that. Nurse retention is a problem today with nurses out of graduation usually not staying over 3 years at their facility or on their floor. And that comes from just frustration or not being comfortable with the floor and just not having a good experience. So learning unit-specific tasks, procedures increases confidence. The more confidence you have, it's just going to, like I said, make you want to come to work. You're confident, you know what you're doing. You don't have to feel like you're bothering anybody to stop during your day and ask, hey, how do you give blood? How do you do this? Or it's just going to increase your confidence, and it's just going to make you a better nurse. Alright, I know this is a little hard to see, but I got this from the informatics section at Piedmont Columbus Regional, and basically it just breaks down the nursing hires for the last year. And you have all your RN hires for the year was 248, and then it breaks down for the full-time, part-time, new grads, or people with over 6 months and over experience. But the important numbers here are the turnover rates. So it's all the way up for 19%, and it is trending downwards to 14.4%, but the national average for nurses with 3 years of less experience is 14, so we want to kind of get below that and bring our retention numbers way down, or bring our retention numbers up and the percentage down. Alright, here's my objectives for this project. Create a unit-based residency program. And that's going to take a lot of collaboration with management, with our supervisors, current nurses, nurses that have been there for over 3 years, because they're the ones that are really going to have to buy into this program. Reduce nursing turnover, that's what I was saying from the beginning. Just you get a nurse out of graduation and they're on the floor for a year and they're already grumbling about, oh, I can't wait to leave this place, I can't wait to get my 1 year experience and get out of here. Let's look at the root causes on why that's happening, try to fix it, and reduce those numbers. Improve confidence and skills. Again, I touched on that. When you're confident, you know what you're doing, it shows. When you're kind of coming into a room like, ooh, I don't know quite what I'm doing, the patients feed off of that, your fellow workers feed off of that. So just boosting and improving confidence. Creating an environment of teamwork. When you're confident with the person next to you and you're building your skills together, your teamwork and morale is going to shoot through the roof. I have a background in the Army. I was in the Army, active duty for 13 years, in the reserves for 8 years, so a total of 20 some odd years. Teamwork is important, and I'm going to touch on that in the future. We as nurses have developed this culture of stress that we wear proudly, but it doesn't have to be like that, and I'll touch on that in a minute. But anyway, create an environment of teamwork. Here's my rationale for this program. Why is this important? Everything feeds into the turnover rate. When you have a high turnover, it's hard to keep that experience on the floor. If people are always leaving, then you don't have that pool of experienced nurses to draw from that are going to teach, train, and mentor the future generations. So when you have a decreased number of experienced nurses, you're going to have higher patient ratios. You're going to have that 1 to 6, 1 to 7, because you don't have the staffing for the floor. You're going to get caregiver fatigue, and I know it's a hot button topic right now, and that kind of feeds into what I was saying earlier about the culture of stress that we've created. But when you're just coming into work and you have to drag yourself into work and it becomes a paycheck, it becomes just something to pay the bills, then everybody loses. The nurse loses, the patients lose, just across the board. What are the causes of the high turnovers? You have low confidence in abilities. So there's something on the med-surg floor that I've been on for a year, and I've only given blood maybe a handful of times. And new people look at me like, oh, he's been here for a while, he should know how to do this. So when they come to me and say, hey, Mike, can you help me do this? And I'm like, I'm kind of sketchy on that because I've only done it 4 or 5 times. Then, that kind of puts a bad light on me because I've been there for a while and I should know how to do these things. Or if they say anything with any kind of skills or policies, procedures in the dealing with the floor. So low confidence, knowledge and abilities. Sink or swim mentality. I've kind of run into that a little bit on the floor. Not a whole lot, but sometimes your fellow nurses can be very indifferent. They're like, well, I know my job, and this new person, yeah, I'll help them if they ask, but that's on them. They're going to sink or swim. They're going to either succeed or not. And that kind of mentality is dangerous because as a long-term or a person with over 3 years of experience, those are your people that are going to help you out. So you're kind of investing in them when you're helping them out to lower patient ratios and improve patient outcomes. So, so that mentality is definitely a cause, and work environment unappealing. So I'm going to get into a little bit of that stress environment that we've created for ourselves. I've noticed, and especially lately, that nurses come in and they're like, oh God, I have to come in again. I don't want to come to this place. This place is all kinds of names. And to see experienced nurses, when you're a new nurse, and see experienced nurses come in with that attitude, that just destroys your morale. It's like, oh man, what have I gotten into? So if your work environment is unappealing, then what's your incentive for doing your best, for going above and beyond, right? And again, I'm going to touch on a little bit more on that. But let's make the work environment appealing. You know, you don't have to come in and rainbows and unicorns and whistling all the time, but you should encourage an environment of, hey, this is a good place to work. Yeah, we have to deal with a lot and we're stressed, but I like this floor, I like this place, and I like helping people. So let's change that mentality of the workplace being unappealing. So again, to carry on with the rationale, personal experience, like I said, the culture of stress. You see it on social media, you see it on the floor. Nurses, we post these memes and pictures on the internet, like, you know, which to nurses it's funny, but to the outside world it's like, wow, that's kind of horrible. You know, why would you put yourself through 12-hour shifts where you're dealing with people who don't appreciate you and poop on you and, you know, doing bodily fluids and all this other stuff. And we've kind of developed this culture of stress to kind of show the world we're nurses and we're valuable and this is how stressed out we are. But by doing that, we're also kind of beating ourselves up by saying this is a horrible, hard job. And when you repeat that enough, you get to believe it. And that's why I was saying that when nurses come in with that attitude of like, I can't believe I have to come in this place again. So, and that's where that comes from, this culture of stress that we've created for ourselves, that we need to break it. Yes, our job is hard. Yes, our job is stressful, but we should enjoy it. I mean, we chose this profession. No one is forcing us to be nurses, all right? We could be truck drivers, we can work at McDonald's, we can do anything, all right? But we chose this profession, and as long as we're doing it, we should convey that this is what we want to do, and this is why we take care of people. So for the past 15 months, 16 months that I've been working at Piedmont on the floor, 6 nurses with less than 3 years of experience have left the floor. Granted, one was for her husband was in the military and they relocated, but the other 5, they went to other facilities, they left for a higher education or something else due to the fact that they weren't happy where they were. And currently on the floor right now, there's 5 nurses that have less than 3 or 4 years of experience that are talking about leaving. And that's where that high turnover rate comes in, and that's when you lose that experience. So my PICO question. My favorite thing in the world is PICO questions. So in a medical surgical floor, nurses, how do unit-based residency programs compare to hospital-wide general residency programs affect job satisfaction? Basically that's what it's saying is, if you have a residency-based versus general, does that make a difference? And unfortunately, there's not a whole lot on unit-based residency programs, but there are a lot on residency-based programs. So that's what I kind of drew off of for my research. All right. You guys still with me so far?
Yeah.
All right. So evidence for change. So these are my 3 articles that I did the research on, studied from. And so the first one is the Central Staffing Intensive Care Nurse Residency Program. It is a program, let's see. Basically, the ICU in the hospital, there's many different types of ICU. There's adult, pediatric, there's cardio, there's neuro, whatever. So instead of doing a residency program for that specific type of ICU, they are doing a general unit-based ICU program. So you have a larger pool of nurses. So when you come into work and they're like, hey, the neuro ICU is short, I know you're supposed to work on the cardio, but we need you to work on that one. You're not sitting there like, well, I'm not qualified. So what they're doing is they recognize that a unit base was going to benefit everybody. So you have that larger pool of nurses to draw from. You reduce the patient ratio, and you are helping your fellow nurses out, and you're increasing the patient outcomes. The study was conducted in a 541 bed with 200 ICU beds, and that's a lot. And when you're dealing with those critically ill, sick patients, you need somebody that's familiar and confident in their skills. So this is the quote that I pulled from this particular research. Orienting nurse residents to an overall departmental ICU program can help control cost, improve morale, satisfaction, teamwork, and enhance recognition, especially for new staff entering the profession. So that greatly reflects on what I said before, is if you have new personnel coming in and they're confident in their skills, that's going to improve morale, that's going to improve patient outcomes. Alright, I was kind of tickled about this one because this is from Dr. Condry, staff member at CSU, and she was, this is the implementation of a preceptor training program. And again, this just reinforces the idea of a residency program, but a preceptor program that the new grad will be with a person that is on that floor to help them with all the procedures, policies, and anything that they're going to be doing related to that floor. So the quote I pulled from this one: the preceptor plays a key role in formal residency programs by guiding the new grad RN at the unit level, thus improving the retention of new nurses. And again, that's from Dr. Condry, retention of new nurses. That's what we want. We want to not only hire new nurses, but we want to keep them for longer periods of time. Alright. And my last one here is factors influencing job satisfaction of new graduate nurses participating in nurse residency programs. New graduate nurses increase confidence in communicating with physicians as well as improve satisfaction. Relating to praise and recognition may be related to increased feelings of competence. And again, this is a recognition piece. So as peer nurses, which I'm not quite there yet, but when I get there, we all have a responsibility of recognizing the good that other nurses do. Say they did a dressing change, or they did a what was it? They did something good, basically. Every example that I had thought of escapes me right now, of course. But anyway, recognizing the good that people do, because we tend to have that mentality of, yeah, I'm going to remember every bad thing you did, but nobody recognizes the good things you do. So when you recognize people for the good things that they do, even if it's a routine thing that they should know, just say, hey man, good job. And that's going to say, yeah, I'm doing a fairly good job and I should keep it up. So just those little things to increase the confidence and competence of our fellow nurses. So a recommendation on how to implement this program, and it's a multi-layered step that would be a very long process. First, conference with the management, which I've talked to my manager about this, and she seems to be on board with it. Of course, it's going to take a long time to develop. But conference with the management and the director, get their approval and their left and right limits of what they want and what they don't want this program to be. The next step would be information gathering from the people on the floor, both with the nurses that have over 3 years and under 3 years of experience. What type of skills do you think we should go over? What policies are you unclear on? What can we do to make you want to stay and improve confidence? Committee creation. So my idea is to create one committee made up of roughly 9 people, and those 9 people would be 6 from day shift and 6 from night shift. You have 3 people with over 3 years of experience and 3 years of less than 3 years of experience, both on night and day shift. Because even on the floor in night and day shift, you do have different things that you do. Like on night shift, we don't do we do EKGs ourselves. Where on day shift they have a person to do EKGs. Day shift, they have to deal a lot more with family members, doctors, a lot of face-to-face. Where on night shift, we're primarily dealing with the patient, one or two family members, and the odd resident that comes up, that wanders up to the floor and asks how we're doing. So the committee creation, identifying those personnel, and very important that they want to volunteer. If you have to drag people into this, it's not going to work. Again, committee approval or committee creation, and get them to look at the surveys, come up with a curriculum, get that approved by management, get some kind of scheduling going, and that's going to be a really tough piece because you have a bunch of nurses out there doing a whole different kinds of schedules. You have day shift, night shift, but then you have trying to corral all those people together. And the biggest thing is whenever you approach a nurse and saying, hey, we have extra training, you get the shoulder shrugs and the eye rolls and the I work so many hours as it is and I have limited time. So educating on why this is important is going to be the key to the success, and getting people to want to participate in this. And then conducting the classes and evaluation. Conducting the training, and then did it work? Was it successful? Did you like it? Did you not like it? What could we do better? What did we do good? And all that good stuff. Okay, recommendations and promoting change. As I hit on earlier, educating the staff on the importance of the program. Convincing them that this program is going to improve their quality of life as a nurse is the biggest obstacle. You're going to have the lower patient ratios and improved patient outcomes, and this is going to be a better place to work, basically. My recommendations is keep the classes short and relevant subject matter. If you just go off on tangents and have 3-hour block of instructions, you're going to lose a lot of people. And also, I didn't have it on the slide, but reinforce that training. So the more experienced nurses, the charge nurses, when you get on the floor, let's reinforce that training that we just had and say, hey, anybody have giving blood tonight or anybody have a trach care tonight, let me know, and we can go in and tackle that as a team, you know, situations dictating. And then promoting change, reduce those retention rates and just create that larger pool and just increase confidence, and let's have those nurses stay on the floor longer. How are we going to evaluate if this is a success? We can do surveys, and then, you know, when you give surveys to people, especially right after the training, they just want to fill those surveys out and get done with it, right? So, sorry. One big important thing is a one-on-one interview with the staff. So maybe the charge nurse or something can get with the people on a one-on-one and say, hey, what did you think of this training, honestly? And do an anonymous evaluation. And then do it immediately after the training, and then maybe a couple days, 1 week after the training, you just go ahead and reinforce that interview or those surveys and say, okay, now that you had some time to let that soak in, what did you think about it? Expected outcomes. So I've been saying this throughout the whole presentation. Increased confidence, reduced turnover rates, increase in morale, teamwork, larger pool of experienced nurses, reduce patient ratios, and improve patient outcomes. That's what it really boils down to. And you're starting with something, and what the major goal is improve the patient outcomes, because that's why we do this job. Conclusion, summary, and it's really simple. I've repeated myself a lot, so I'm not going to do it again. Reduce the stress, improve morale, confidence, and teamwork, and improve the patient outcomes. These are my references. Thank you guys for being here. I hope I didn't take up too much of your time. And this has been my evidence-based PowerPoint presentation on unit-based residency programs. Thank you.